Hello students. So let us begin our class on European Society of Cardiology 2018 guidelines for the management of hypertension. Okay. So according to these guidelines, we shall focus today on the classification of blood pressure in adults as per the ESC guidelines. So the classification of office blood pressure, the optimal is less than 120 systolic and less than 80 diastolic. The normal is 120 to 129 systolic and 80 to 84 as the diastolic. High normal is regarded as 130 to 139 the systolic and 85 to 89 as the diastolic. Grade 1 hypertension is 140 to 159 systolic and diastolic is 90 to 99. Grade 2 hypertension is 160 to 179 systolic and 100 to 109 as the diastolic. Grade 3 hypertension is more than 180 systolic and more than 110 as the diastolic. Isolated systolic hypertension is considered when the systolic blood pressure is more than 140, but the diastolic is less than 90. So, and you should also note the following point that when hypertension can be classified in two different categories based on the values of systolic and diastolic BP, then the higher category is considered as the classification of hypertension. For example, if the diastolic BP of a given patient is in the range of 90 to 99, but his systolic is 160 to 179, then he is classified as a grade 2 hypertension. Alright. So moving ahead, let's see the types of hypertension. The most common being primary essential idiopathic hypertension. So this is the most common type and a particular cause or a single cause is not known. What about secondary hypertension? It is usually correctable and it has a definite cause. For example, pheochromocytoma, renal artery stenosis, alright? And these usually develop before 30 years or after 55 years. Isolated systolic hypertension, like previously told, more than 140 systolic and less than 90 diastolic. Isolated diastolic hypertension is when the systolic is less than 130 but the diastolic is more than 80. Very important for your NEET PG as well as your next exams is what is white coat hypertension. The office blood pressure being more than 140 by 90 on 3 separate office visits, more than 2 blood pressure measurements taken outside the office, less than 140 by 90, frequently using a BP apparatus at home, and there is no evidence of hypertensive target organ damage. All three criteria must be fulfilled. Okay. So based on the concepts that we have learned today, let's try to solve some MCQs. The first is an 82-year-old male patient complains of headache and dizziness. His ambulatory BP was recorded to be in the range of 144 to 152 his systolic and 80 to 86 is his diastolic. What is the likely diagnosis? Is it A, white coat hypertension, or is it B, grade 1 hypertension? Is it C, isolated systolic hypertension, or is it D, secondary hypertension? So I am going to give you a moment for you to think about the answer. The correct answer here is option C, isolated systolic hypertension. See, what is isolated systolic hypertension? Like previously told, the systolic should be more than 140 mmHg, while the diastolic BP should be less than 90 mmHg, is called as isolated systolic hypertension. Why can't this be a white coat hypertension? Because it must fulfill the following criteria. That the office blood pressure should be more than or equal to 140/90 on 3 separate office visits. Alright? And it should be greater than or equal to 2 blood pressure measurements taken outside the office, that is less than 140/90, frequently using a BP apparatus at home. Plus, there should be no evidence of hypertensive target organ damage. Right? In this question, ambulatory BP monitoring was mentioned, which means the patient was not only in the office, he was outside the office. So the systolic BP was more than 140 during these recordings. So he does not fit into the criteria of white coat hypertension. Moving on to a second question for the day. A 59-year-old male patient presented to the clinic for a routine clinical checkup. On examination, his BP was found to be 136/88. During his subsequent visits, the systolic blood pressure recorded was found to be within the range of 130 to 138, and diastolic blood pressure was usually within the range of 86 to 88. So, according to the ESC Hypertension 2018 guidelines, how do you classify his blood pressure? Is it high normal? Is it completely normal? Is it isolated systolic hypertension? Or is it grade 1 hypertension? All right. So, among the options, the best answer is option A, high normal. So, according to the European guidelines for hypertension 2018, the SBP between 130 to 139 mmHg and diastolic BP between 85 to 89 mmHg is classified as high normal. So, dear students, with this, we conclude this topic of classification as per ESC 2018 guidelines for hypertensive management.